Good evening, everybody. This is Dr. Mustapha with KSB Medical Group. Today we will discuss the importance of colon cancer screening. Colorectal cancer is the third most common cancer diagnosed in the U.S. Close to about 150,000 cases will be diagnosed in the U.S. in 2021. It is the second cause of cancer death in the U.S., and it is expected to result in about 53,000 deaths in the U.S. only in 2021. The lifelong risk for developing colon cancer is about 4 to about 4.5%, or roughly 1 in 24 people will develop colon cancer in their lifetime. There are risk factors for colon cancer. Some of those can be modified and others cannot. So we're going to start with the risk factors for colon cancer that can be reduced. The first one is being overweight or obese. The second one is not being physically active. There are diet factors that can affect the risk. The first one is a diet that is rich or high in red or processed meat. That increases the risk for colon cancer. Cooking the meat at a very high temperature, as well as low blood levels of vitamin D. So all of those increase the risk for colon cancer. What can protect us from colon cancer? A diet high in vegetables, fruits, and proteins is good in reducing the risk, as well as there are some potential to a diet rich in omega-3 fatty acids, coffee, garlic, calcium, and vitamin D. Smoking is also another risk factor for colon cancer, as well as many other cancers. Alcohol use, even in light to moderate drinking, is also associated with an increased risk for colon cancer. Now we're going to go to the risk factors that cannot be reduced. Being older is a risk factor. A personal history of colon cancer or colon polyps increases the risk for colon cancer. Personal history of inflammatory bowel disease, which includes ulcerative colitis and Crohn's disease. Family history of colon cancer or adenomatous colon polyps. Having an inherited syndrome such as Lynch syndrome or FAP. Being of African American descent or Ashkenazi Jew in descent also increases the risk factors, and those are genetic risk factors. Having type 2 diabetes also increases the risk for colon cancer. We also have noticed that the risk of, or the incidence and risk for colon cancer continues to increase. It is estimated that people born around 1990 will have twice the risk for colon cancer and 4 times the risk for rectal cancer compared to those born in the 1950s. We believe diet is a big factor in pushing this risk. Now, how often and when to screen for colorectal cancer? According to the United States Preventative Services Task Force, it is recommended to start screening for colon cancer at the age of 45. This is with a grade B evidence. At the age of 50 with a grade A evidence, the best evidence available. The American Cancer Society also recommends to start colorectal cancer screening at the age of 45. In general, most medical societies would recommend to screen for colorectal cancer between the ages of 45 and 75, and that's in average risk individuals. Sometimes we screen earlier in higher risk groups. For those patients who are 75 and older, the decision whether to continue screening or to stop should be personalized depending on the patient's preference, their life expectancy, their overall health, and also the results of the previous screening tests. All medical societies recommend against screening for the 85 years and older individuals. What are the tests that can be performed to screen for colorectal cancer? There are visual exams and there are stool-based exams. The first one is the colonoscopy of the visual exams. It is performed every about 10 years. It is considered to be the gold standard test. It both detects colon cancer early and prevents colon cancer by removing precancerous polyps. It requires a bowel prep. It is performed under sedation or anesthesia. As such, it is well tolerated and it is highly accurate. Flexible sigmoidoscopy is done every 5 years. It is less commonly performed as it examines only the left side of the colon or about half the colon. Anesthesia usually is optional. CT colonography, otherwise known as virtual colonoscopy, is performed every 5 years. It is not covered by all insurance plans. It is non-invasive, however, it is associated with some discomfort, and it is not available widely. Stool-based tests, there are 3 of them. The first one is called the FIT test. It is done every year. The second one is called the FOBT test. It's also done every year. That's an older generation test. The third one is the most recent one, which is called the multi-targeted stool DNA test. It is done every 3 years. And an example of this will be the Cologuard that a lot of people will be familiar with. Any positive stool test would require a colonoscopy as a diagnostic test. Colonoscopy in general is superior to any of the tests mentioned above due to the higher sensitivity and specificity for colon cancer and for detecting and removing precancerous polyps. I hope this presentation today was helpful. My main message today is that colorectal cancer is common, but it's also preventable. If you are 45 years or older, please talk to your primary care physician or provider about colorectal cancer screening. Thank you and have a good day.